story out of the UK as well. And involved in this article is Mike Barnes, who we had on as a guest just a couple of weeks ago. And that was a good interview, that was, everybody. If you haven't listened to the Mike Barnes interview yet, then go and give that a look, man. He's a super cool guy. We should get him on again sometime. As we do. Good interview.
Had a few.
The headline of this one says, UK Medical Cannabis Model Inadequate and Unsustainable for Patients, which we've been saying this for a long time. It's not good enough, especially when we have the NHS here in the UK, where we can get our medicine very cheap compared to what well, not cheap, it's paid for by taxes, so it does get paid for.
But that's where you're supposed to get your medicine from.
That's it. At the point of use, it's very cheap and readily available for everybody. But when it comes to cannabis, you have to go to a private clinic and see a private consultant, and they'll make sure, you are eligible for this shit. Now pay us more money, and we'll give you, the medicine you need, which is often low quality. But I've heard it's getting better recently. But anyway. So it's inadequate and unsustainable. Too many people cannot get this medicine. And again, we've heard from the moms who have been on the show before, who have to pay thousands every month. They have to do fundraisers on Facebook to get the money they need to buy the medicine their children need. And it's fucking disgusting. It shouldn't be like that, especially in the UK. We have a better system than that, and they're just taking advantage of people, in my opinion. But it says here, the UK government have been accused of complacency as leading bodies call for more rights for medical cannabis patients. A UK patient body established to address the inequalities in access to cannabis-based medicine products in the UK has called the government to extend the rights of medicinal cannabis patients and at Cannabis Europa, Europe's leading cannabis conference. So there's been a big conference recently where a few of these guys have got together and discussed what's going on, which is good timing for Germany as well. Germany's going through this thing right now. There's PLEA, P-L-E-A, a patient-led organisation, was joined by Lyphe Group and the Cannabis Industry Council in labelling the UK's medical cannabis model as unsustainable, arguing that chronically ill patients should not be forced into a private market, many of whom can't afford due to lack of NHS prescriptions. So, and this is the problem we're seeing. This article is spot on, man. It calls it out well. This is from cannabishealthnews.co.uk as well. So check these guys out, man. It seems to be a decent site for us in the UK. But a lot of good arguments brought up in this news article, which we've all discussed before, on many occasions, man. It's absolutely shocking what's going on here in the UK. It's like you can have cannabis now for medicine, but you have to be able to afford it. And these people who need cannabis as medicine often have chronic pain, epilepsy, or many other conditions that stops them from being able to work and earn enough money to pay this. Even if you are working in the UK nowadays, it's hard enough to earn enough money to pay these fucking medical bills here. So it says the UK cannabis clinics cost from 140, with £75 being charged for follow-up visits and an average of £50 per repeat prescription. And it's like a prescription in the UK. Usually it's about £10 depending on where you are. And if you're a pensioner, if you're over the age of 60 or something, then you don't have to pay for it either. So you just have to pay this £10, and it doesn't matter what it is. It's your medicine. It could have numerous bits of medicine in there, painkillers and some suppressants or some antidepressants and shit like that. It's still £10. It's like a bulk thing you buy, and that would be the case with the cannabis here. This is how it should be given out on prescription. Be prescribed by your doctor on prescription. You pay a tenner, you get what you need, regardless of if it's fucking 3 ounces or half an ounce. It's £10 you'll pay, and you'll get the medicine you need. This is the argument they're trying to make. Yes, Bubble?
We call it the PBS down here, so Pharmaceutical Benefit Scheme. Very, very similar, but it has to be approved by our Therapeutic Goods Administration before it can be listed on the PBS. So any cannabis medication at this point has not been approved by the TGA. So if you're a medicinal cannabis user here in Australia, you essentially have to do an SASB, which is a special access scheme thing. So you send that through to the government, and then they go, "Oh yeah, you're okay, you can have it."
Yeah.
And then, but you pay for that, like as it's explaining here. It's very much
how many
the same
people are they
model.
turning away? It's like, oh, you could be a customer, but we're gonna say no. It's like, fuck off. They're letting everybody in. Anybody who asks, they're letting them have it for sure. They're
Well,
not
look
turning
at
people
look
away.
at what it's costing. Well, I mean, if it's costing people that amount of money, imagine the amount of money that people are getting from this. You know, like the government's
Mhm.
raking in coin in bulk amounts because people want it. Yeah, and that's on medicine. Again, I'm not going to get started because I'll
Yeah, man.
rant for an hour if I get on that.
He says here the UK's preeminent expert on the issue, Professor Mike Barnes, who again was on the show just a couple of weeks ago. Just scroll down a little bit on your podcast thing, whichever you use, and you'll find it, and you can listen to that interview. And this guy, Professor Mike Barnes, it says pointed the finger squarely at Home Secretary, highlighting that changing one line in section 7.13 of the Misuse of Drugs Act regulations in 2018 would enable GPs to prescribe medicinal cannabis rather than specialist doctors.
Nice.
Professor Barnes, who is the chair of Cannabis Industry Council, commented the UK's cannabis market is completely inadequate to cater for the demand of medical cannabis. The government must wake up, face reality, and put patients first by enabling GPs to prescribe life-changing medicine. Legend. This guy's so cool, man. You have to go check out that interview if you haven't heard it. Professor Mike Barnes. But super cool guy. You were there for that, weren't you, Bubble?
Yeah, I was. Yeah,
cool,
I think
cool. And Monkey was there too.
Yeah, man, he was like telling he told us how many people in the UK weren't even aware you could have medical cannabis was one of the big problems. I mean, people don't even know how to get it.
Yeah. Currently, just under 20,000 patients in the UK are granted legal access to medical cannabis, with only around 110 specialist practitioners able to prescribe in the UK. However, if it were to be made widely available on the NHS, this number would increase to 80,000, enabling every patient to access the medication they require. And that's what we do here in the UK, motherfuckers. We have the NHS, you know.
How long have you guys had a legal, a medicinal industry?
Only since 2018, November 2018 it was, and nothing's changed since then. And the only reason why we got that is because of ladies like Hannah Deacon, and you know, fucking all the other ladies and the names.
Yeah, I mean,
Joanne Griffiths. You know,
they had to bring kids in there that was, you know, horribly sick, and that's what it took to actually make the needle move at all. It was ridiculous what they had to do.
The only reason I'm asking is because we've got a smaller population, and there is a lot more prescribers here in Australia than that.
Right.
And there's a lot more patients. And you would have thought in a country like the UK, surely by this point, there would be at least
Mate,
more...
we've had Boris in charge for the last fucking how long? It's been Tory government for 12 years. It's like fucking hell, man. And the Labour's even shit. But let's not go into political rant right now. You know? But you know, the UK is fucked pretty much, all right? Fucked.
There's always the stigma though within the medical community though. You know, a lot of times when you said it's only been legal for a little while, so you probably have similar problems that we have down in the South here, and the doctors are afraid to even touch it because, oh, that's that stuff we're not supposed to do anything with.
Yeah.
So I mean, you gotta bring the doctors to actually want to try to use the stuff. I don't know how you do that.
Yeah, it's just proof that you know, prohibition has caused way more harm than it has good.
Yeah, it's going to take years to get all of this stuff through.
Just seeing here, it says Cannabis Europa, which took place in London last week, hosted 1,200 activists, academics, and advocates from over 40 countries, as the industry gathered to talk about the expansion of the medical and recreational cannabis markets in Europe and the investment opportunities that have arisen as a result. So things are changing, man. The fat cats are talking about it now. They see the potential of making some money, so things are going to change pretty soon, as far as I see it. Dr. Bonnie Goldstein was there, and Hannah Deacon was there too. Carl Hart was there, Stephen Murphy. Lots of big names from the cannabis world went there. Very cool. So you can see on the first picture here, Dr. Bonnie Goldstein. A dead child is better than a child on is not better than a child on cannabis, but you know the UK government seems to think it's the other way around. Lots about cannabis patients here. We have
yeah, we've had foreign members say that the Child Protective Services are coming after them because they've had given their epileptic child THC to control seizures.
Yeah, it can be seen here in this picture. There's Bailey from Bailey Shakes as well.
It's ridiculous, man. That people are going to get for giving your kid medicine that's helping. It's crazy.
It's infuriating to me that you've got to choose between having your kids taken away or giving them life-saving medicine. Like, that's absolute bullshit.
Yeah. Who would ever make a parent make that choice?
British Cannabis
Exactly.
confirmed as UK's largest CBD manufacturer. Get shares in these motherfucking companies. See that? This is not financial advice, but
I agree,
get
Teo.
British Cannabis in that shit. Yo, what's up, the American one? I saw you there, bro. What's up?
I agree. Everyone should cultivate their own cannabis and should be allowed to. 100%.
And that's it. And if people can't, they should be able to get it from people who can.
Yeah.
Crazy shit, man. But I think we'll get there eventually. Another 40, 50 years.
Yeah,
if we're still here.
Give or take a few deaths in the monarchy, and you might get there eventually.
Maybe.